Oh, yeah.
Welcome to PAMED Talks, a podcast brought to you by the Pennsylvania Medical Society. I'm Arvind Cavale, the 176th president of the Pennsylvania Medical Society. And today I'm delighted to be joined by Dave Chase, who's the co-founder of Health Rosetta. It's a very intriguing company, and I will let Dave explain how it came to be and what it means. So welcome, Dave. I am really excited to have you here today.
Yeah, I'm really looking forward to our chat. We've had some great communication over the years, and congratulations officially in your capacity with the society. That's terrific that you're leading the organization.
Thank you. Yeah. Let's start from the beginning, shall we? Where did you start off with? What's your primary specialty and how did you end up with healthcare?
Well, it's definitely not medical. So, if there's a medical emergency, I'll point to one of you guys. But yeah, love working with docs. But my background, I started my career in management consulting and working inside of big health systems where the clients and basically helping them get bills out the door and get them paid. It was a pretty simple time, back in the sort of late 80s, early 90s. So it's been a while. And then I went on to start Microsoft's healthcare business. So, you think of them as making Legos that other people assemble into solutions. And today there's, at least last I heard, there's about 28,000 partners around the globe on Microsoft's platform. It's been quite successful. And then I detoured away from healthcare, but really it was a personal scenario that really pulled me back more than anything. And we're going to talk about it, right? There's victims all around with our system. And in my case, it was a friend who'd had a similar career to mine, had some success in tech. But unfortunately, the short version of the story is she got destroyed by the healthcare system and ended up dying essentially bankrupt, leaving behind a 10-year-old daughter. And this was somebody who was hardly destitute before. And when I tried to do what I tried my best to do is find some meaning out of a sad situation, it was very clear that it wasn't a single bad hospital or bad doctor or bad nurse or something like that. It was systemic. And at some level, I'd been a part of that system. And, the way I was raised, if you see a problem, you don't do something about it, you're complicit. And so I joke that I became an archaeologist and I started digging around for healthcare's Rosetta Stone. Like, who had actually cracked this seemingly indecipherable code? And I fundamentally believe no matter where you are in the world, people are problem solvers. And so I was like, I'm going to find out who solved this and figure out if there's a way to replicate that. And so we'll get into that. But that's really been kind of my arc that's gotten me to this place. And I'm fully sober about the problems that exist out there. I've seen them, at a personal and professional level, but I'm incredibly excited about the fact that we're having a once in a career transformation. We're still in the early days, but it's really bringing light back into the eyes of doctors and benefit consultants and stuff like that, that we're trying to do their best work, but frankly, the old system was keeping them from doing that.
Yeah, yeah. So that's exactly how I felt as well. And my personal journey also began as a caregiver for sick parents, and I was personally affected by not only their illness, but how it sort of devastated the finances of the family. And so I've always practiced keeping that in mind with my patients to say, what are my actions doing to their finances, not only to their health, but also to their financial health? And what I found over the years is that not too many doctors are very well equipped to think about it in that manner. And sort of what triggered me to take this path of offering myself to serve the medical society as vice president and president was a chance encounter with a fellow physician in a hospital in January of 2020. I became chair of medicine at my local hospital. And the first thing I did was I got hold of the patient concierge department. This was a group that would go around and talk to patients about, okay, did you get your care? Are the nurses responding? Do you have a phone in your room, et cetera, et cetera. So every Friday I would round with them, just go from one room to the other and say, hey, I'm the chair of medicine, and is your care being taken care of? Whatever, those kind of questions. And I met a good friend of mine who was as senior a physician as I was. We started around the same time in practicing in the hospital. Very respected, highly intelligent, dedicated specialist. And he asked me, like, "Oh, what are you doing here?" And I said, I'm the department chair, in case you forgot, and I'm rounding with the patient concierge here. And he looked at me and said, "Wow, that's really good of you, but we're all just going through the motions here," he said. That sentence has stuck in my mind. I said, if a person of his caliber, his dedication, his experience is just going through the motions, I can't imagine being a patient in this system, right? And how do patients rely on physicians when they're just going through the motions? And it sort of dug through the whole thing. I said, and we are really taking people who have dedicated their lives and putting them through the motions, essentially. And so I said, there has to be, like you said, I started looking for solutions, and I couldn't find solutions because I've always been a small practice and mostly independent and in the community. So I didn't have any connections with the large systems or the organized medicine or whatever. And it turned out that I just had an opportunity to run for this position. I spoke to about 200 people who were attending the conference, and I got elected. And everybody was shocked. I was most shocked because because I didn't know most of these people, right? So I realized that physicians are also victims of the same scenario, same system. So are the patients, and so are the communities. So coming to that, and that's how I sort of also got into what you were doing with Health Rosetta and all these other, parallel processes. So tell me about how you came about sort of thinking of Health Rosetta as a structural entity.
Yeah, one of the things I learned, is if you ask why, five times, you're going to pretty much always get to the root cause. And I learned that in healthcare, there's no accidents in terms of the dysfunction. And, the list is endless of the dysfunction, but it's all written into a bunch of legal documents we call health plans, right? Like, what is a health plan? It doesn't provide any care, didn't go to med school, but it governs everything. And so I did this crazy thing of like, hey, why don't we rewrite those? Right. And at the end of the day, we've spent seven figures to completely rewrite those because that governs everything for good or ill. And unfortunately, it's had devastating effects. As you said, in many ways, doctors and other clinicians are even more of a victim because they live it every day than the rest of us. But I don't, while I'm very bullish on the future and very optimistic and forward looking, the first chapter of my first book, The CEO's Guide to Restoring the American Dream, How to Deliver World-Class Healthcare at Half the Cost, was we've gone to war for less than what healthcare has done to America. So like that's a pretty direct hit. And I went through like 10 different fact-based arguments around that. But then it's like, okay, what are we going to do about it? And if you look at great societal problems, there's grassroots movements that are long-term oriented, and that's really the only thing that has a chance against a $5 trillion monster. And one of the quotes that I came across was from Buckminster Fuller. You never change things by fighting the current reality. You have to create a new model that makes the old obsolete. And this is when I like to wave my iPhone in front. Like, we didn't get this by tweaking landlines and rotary phones. If you look at health plans today, they were designed in an era where the workforce was the greatest generation and young boomers, and the main issues were acute conditions. Well, today, boomers are largely retired. or retiring. The biggest chunk of the workforce of millennials, they're in their mid 40s. And the main issues are chronic disease and mental health. And so it stands to reason you're going to have a new system. And one of the things that's really surprising to people, and I say it, to jar them a little bit, I say, healthcare is not expensive. And they're like, what do you mean? We're spending way more than anybody else around the world. And it's stolen 30 years of wage gains, dot, dot, dot. I said, well, what I think of what healthcare is what clinicians do, right? And if you add up all the payments from medical assistants through physicians, um, add
Versus
30% for
pharmacists.
benefits, it's only 23 cents of every dollar, and it's only 5 or 6 cents for the docs. So what's
Yeah.
expensive is profiteering, price gouging, administrative bloat, fraud, and some inappropriate treatment. Those are actually optional when you take control. And so that's really become the focus of, okay, there were these pioneers who figured it out. How do we replicate that? And that's really been, what I've been called to do as my life's work, is figuring that out. And fortunately, we've proven it out thousands of times now.
Yeah, that's exactly true. And I love the statements you made in the past that we already have a fix. We just have to apply it, right?
Yeah.
And so for physicians, and this is sort of my task at this point, is try to educate and illuminate to physicians that we're not in it alone, right? So in fact, yesterday we had our my county's annual meeting, and I was explaining, what we are up to here and why they should participate. Even if they're hospital employed physicians, they should participate in what we are trying to do at the Pennsylvania Medical Society. And their understanding was very minimal. And it's not by accident that physicians are sort of in the dark as to why new ideas cannot flourish. And why do you think, how do you, as a non-physician, um, how do I say, imagine you can illuminate some of these areas for physicians?
Yeah, I mean, it starts with, their frustration and or curiosity. Um, and frankly, until people see it with their own eyes, it sounds too good to be true. You mean there's happy docs that are able to actually practice medicine the way they were trained, and then there's happy employers, and essentially I put everything through the quadruple aim, right? Improve caregiver experience, improve patient experience, better outcomes, lower costs. Guess what? That's actually very doable. And when they see it with their own eyes and they um, and see, gosh, I want to be part of that. I mean, I think back to college, and there was, I think, two groups. Like there was my buddies who became docs that were on Saturday night. They're in the library while the rest of us are whooping it up. And some of the people that I was whooping it up with, became benefit consultants, good
Mm.
people, right? But they didn't have, breaking news. It's a little harder to become a doctor than a benefits broker. And so, and then if you look at the roots of medicine, it's Greek, right? Fealty to authority, stay in your lane, specialization. And I think for a long time, that whole financial stuff, let's keep them in the dark about it. And they're the financial specialists. They might not be medical specialists, but like there's a respect for specialists. Now, unlike other professions, doctors gave away their profession. Engineers, accountants, lawyers, they did not do that. And so I think there's been this awakening that, God, I mean, these are, people who really called at an early age. I mean, I was in my 40s before I really figured out what my life's work was. And so when people see that, it becomes this magnet that pulls people in. One of the things I learned when I studied social movements and revolutions is you only need 3.5% of a population to tip. That, you think about, could you get 3.5% of the Pennsylvania Medical Society to go, maybe there's something different. In fact, as much consolidation as there's been, it's still 25, 30% of docs are still independent. So like you only need, you know, a little less than, a little more than 10% of them.
Right.
And so that's what, and certainly they'll support it. It's funny, bump into people that, I've been a high school track and cross country coach on the side, and some athlete's parent, like, meets me and like, okay, what's your day job? I'm going, I'm trying to fix healthcare. And like, good luck with that. Like I'm behind you, but good luck with that, pal. And I get it, right? Like it's really hard inside the system, but that's where there is an entirely new healthcare economy that's emerged that's approaching $100 billion market. That's a huge market. That's bigger than the US video game sales. Now, is that huge compared to 5 trillion? No, but you got to start somewhere. And it's growing rapidly, and big things always start small. Well, 100 billion is not that small. So we're not asking any docs to take a vow of poverty. There's thousands of docs. It probably started more than anything with direct primary care docs. And then there's probably just as many direct specialty care docs. And so when they see it, I was like, I tell these docs, put on your strongest stink eye. Go ask, go talk to these people, and you make your own call. And come to our event, come one of these things, read my books, whatever works for you. Be as skeptical as anything, um, but fundamentally, these are smart people who dig in, and so that's why I see more and more be liberated. And one of the funnest things for me on this journey is I show up at some events, a DPC event, or it's the ortho forum, for independent orthopedic, and somebody comes up to me, and is like, I read your stuff, and I was like, I'm done. I'm going to this new thing. I mean, great. Like, I always wonder who's on the other side of that page view, on some article
Yeah.
in Forbes or whatever. So it's there. It's incredibly exciting when people make that switch. But, again, people listening, people watching, be skeptical. You have every reason to be skeptical, given a lot of broken promises along the way. But it is real now, unlike anything I've said or seen in my career. And we've said it's unsustainable forever, right? We've all heard that. Guess what? It's now come home to roost. And frankly, we have a system that's collapsing in on itself right now.
Yeah, yeah. I think that's the opportunity, if you ask me, to create, like you said, another pathway for what patients and physicians to take. And that's sort of where I came into the society leadership as, two qualities that or two emotions that I bring with me are like, gratitude and optimism. And they sort of go hand in hand because, how many people get to be healers, right? So
Yeah.
and we are truly trained to be healers. And the second thing is, how many people are really optimistic in our profession? And that's where I got stumped, honestly, because a lot of people were just, not taking me seriously because I was so optimistic that, hey, look, the time has come, the people are there, the opportunity exists. We just have to show up and make our presence felt. So we talked about the Independent Practice Summit that we are having on June 19th, and some of the benefits plan managers or architects who have the Health Rosetta model in their mind are going to be with us, along with possibly some of the tech companies, along with possibly the business groups on health in the area. So if a physician or physicians group says, what is Health Rosetta connection with us? Like how do we answer that question?
Well, one, I mean, if you're well, I mean, I guess either way, you're employed by somebody. Either you're, running your own practice and you're kind of self-employed. But even if you're a part of a larger system, um, the by far the most common way people get healthcare in America is through their employer or union. It's like more than Medicare and Medicaid combined. And it's a wonderful place to start no matter where you are. And that's actually where we've had a lot of successes. Start to understand that because I'll hear from some of them about their frustrations with, fill in the blank carrier. And then I ask them, well, what do you offer your employees? And it's like, fill in the blank carrier.
There
I'm
you go.
like, hmm. interesting. Do you see a disconnect there? And like, of course, many of them don't think there's another option, but there actually is. And if you look at the system that we have, the employer market is the only area of permissionless innovation in healthcare, right? You want to do something. Of course, there's some laws to follow, but it's not that hard. You can do anything you want. And then it's a very step-by-step process that demystifies it. And one of the things that's been interesting and surprising to us is we have this program that's designed for, the layman would call them like an insurance agent. They tend to be called benefit broker, benefit consultant, benefit advisor. But to our surprise, we've got probably a dozen clinicians that joined, and they said, gee, maybe you're a DPC doc and you know an employer, they're on board and they want to have DPC for their company, and then they get cut off the knees by some joker that, was loyal to the old system. And they're like, screw that. I'm going to get my license and join this. And essentially, it's like getting a non-clinical fellowship. And candidly, if you care about population health, it's pretty hard to do population health without understanding health plans because you know the the most probably the number one comorbidity in America is the cost of care and various obstacles to care. And you'll hear the term, financial toxicity is clinical toxicity. And so when you get into that, then it's like, okay, it's pretty straightforward what you do. And so that's what we're helping train people on. And the one of the forbidden words in our lexicon is payer. Like calling one of these big carriers a payer is like calling H&R Block a taxpayer. Like they're just telling you where to send your money. I call them carrier because they're carrying your money around, grabbing big wads out along the way. And we're actually, I'll sometimes, be provocative. I'll say, oh, we already have single payer. People are like, what? What do you mean? I'm like, have you heard of any Italians or Australians volunteering to pay for our healthcare? Like, it's all us, right? It's just there's different middlemen and different, like, it's on us. And the cavalry's not coming from DC to fix it. And we can do that. And it's a straightforward process. We've done it thousands of times. It's been in place in some organizations and communities 30 years. It's just not that known. And that's been probably our biggest obstacle. And we love it when medical groups, like in Pennsylvania, Verber Dental Group is as it sounds, a dental group that has adopted this type of plan. We have medical societies now building community-owned health plans, we've got pharmacy companies that are doing this. We've got orthopedic groups that are doing this. They're all the real payers of healthcare.
Mhm. Yeah, I think doctors would love to hear that. Right? So we're pretty kind of fed up of being told who the payer is as well, right? But when you see or listen to hear the conventional talk, they always talk about the carriers as payers. And I think once we sort of remove that concept from our heads, a lot of things become very clear, right? So would you want to say a line or two about how physicians can also work with their own community organizations or employers?
Yeah, yeah, definitely. Um, you know, First of all, it's really um, a missed opportunity when physicians who have, they're the second most trusted profession in America after nurses, and they have hard-earned credibility. And the root, of the word doctor is teacher, right? And if they could they don't have to become salespeople, but just start to A, understand it, B, educate their neighbors, their patients, their, fellow church, temple, synagogue goers, whatever, right? Start to educate them and then find your allies. There's probably a DPC doc in town. You can be surprised. There's some independent, kind of cash only direct pay in a lot of communities. And then, within the Health Rosetta world, if you just go to healthrosetta.org/map, you can see them on the map. And, I think where your event is in June, there's a advisor named Justin Leader, terrific guy, and he understands this very well. And we're not expecting you to become the super subspecialist in insurance plan design, but find the people who are aligned. and they're definitely out there. And again, there's a lot of employers who are just like a lot of docs. They just don't know there's another option and they're just kind of going along to get along. Um, and that's fine. Uh, find the ones who are fed up. And, in your, state, I know there's like, I was just looking at some of the award winners for the best health plans in America. And there was, I mentioned Verber Medical Group, Philips Managed Support Services, Phoenix Contact, Country Lane Woodworking. Like, what's common about all of them? They're in Pennsylvania, like different industries, right? They're manufacturers, they're customer support, they're provider organizations. And the other thing that we've seen where folks are particularly um, open is not only provider organizations because they're living every day, but some nonprofits, right? They're running tight margins, public sector entities, cooperatives. We have and credit unions, grocery co-ops, farmer co-ops, electric utility co-ops. They kind of already understand taking ownership and kind of the owner and customer are sometimes the same. And so those are great folks to start to have these conversations. And you bet this is not going to happen overnight, but get educated and take a step at a time. We have a 5-step change process, and by far the biggest hurdle is the first one, which is just learn to leave behind status quo mindset and thinking that solving healthcare is like trying to solve Middle East peace. They got you if you believe that. If you don't believe that, you are on your path to success. The rest of it's frankly easy by comparison, as long as you're diligent and patient. And anybody who got through, medical school, residency, in many cases fellowship, man, these are people who know how to delay gratification and grind. And this is frankly a lot easier than that.
Yeah. Yeah. So that's what I tell, I just had meetings with our resident and fellows section last week, and then this yesterday, medical student section, and it was a well-attended Zoom meeting, and that's what I was saying to them is we are sort of almost have-beens, but they are the future of our profession. And so we are doing everything we can through the medical society to expose them to new ideas, new ways of thinking, or at least not fossilize in older ways of thinking, like you said. And so, is there a message you want to send to these young folks who are just entering or will be entering the practice of medicine in the coming year, two, three, four?
Well, thank you, because most of them know a doc or have a family member who's a doc who've basically steered them away from the profession because of what it's become, and that yet they've still persevered. So that tells me how committed they are. And so just thank you for grinding, to do that. And then and the fact that they've been willing to pursue this in spite of that just tells me they're really open to this. And we're seeing more and more docs right out of residency, the primary care, they're going to, direct primary
Direct
care.
primary.
They're finding independent medical groups, and they've been sort of, you know, gaslit into believing the only way you can work is to work for a giant healthcare system. And if that's what you want to do, that's no problem. We
Fine.
need them.
Yeah.
But that's not the only option.
Yeah.
And so it's just dive in and get excited about the fact that, as you said, they're gonna drive this transformation. And when they're our age, they're gonna have already an incredible legacy of building the replacement for the current system, because it just won't stand much longer. And they're going to be the ones who will be the kind of phoenix rising from the ashes of the old system.
Yeah. Yeah. And that's what I keep, saying to them that, we just want to create the platform for you to take off of, and something that wasn't created for us when we started about 30 years ago, so yeah, it's interesting how kind of, you know, we're almost twins, you and I, right? So we came from opposite ends towards the same sort of destination in the
Yeah.
middle somewhere, right? So which is kind of interesting, right? So finally, if you have to give us a sort of a 30-second speech of optimism or some kind of, method where we can show it to our physician members and say, hey, look, there are people outside of medicine who are wishing us well and willing to work with us. What would that be?
Yeah, first of all, we are so dependent on physicians doing the right thing. And I want you to imagine a future where we've gotten rid of the 30 to 50% of healthcare waste, and that allows us to not only deliver world-class healthcare outcomes by blocking physicians and other clinicians from doing the right thing, that we can fully fund things like education and childcare and elder care. And the great thing is, it's already happening. You actually don't have to imagine. There's a famous quote, the future is here, it's just unevenly distributed. All of the solutions to fix healthcare have already been invented, proven, and modestly replicated. We just need to bring it into one place and at scale. And it's a completely different country that we have and a completely different future that we leave behind for our kids when we're ready to move on.
Yeah, well said. Yeah, I like that statement. Right. So we're always looking for opportunities to make the future better than the past or the present. And so that's that, I think we've had a very nice conversation today. If there are anything else, any other ideas, would you want to
Well,
say that?
I would be remiss if I didn't give you a heads up about my upcoming book that we're going to launch at Rosetta Fest. I certainly would love to have docs come to Rosetta Fest, which is at the end of July in Nashville. But that's where we're going to release the book. The book is entitled Relocalizing Health, and the subtitle is Taking Back Healthcare, Rebuilding Communities. And I think that really describes our work. And I document these successes that are happening all over the country and sharing the blueprint of how you do it. Like it's no longer a ivory tower concept if it ever was. It's being done. So I welcome people to come to our event, read the book, and certainly I'll make it available to you as early as possible. And if you like it, please share it.
Absolutely. Yeah. So it's called rosettafest.org, is it?
Yep. Yep.
Okay, great. So I'd just like to thank you, Chase, Dave, to really for really sharing your journey, your message, as well as your optimism. I think doctors really need optimism at this stage in the where we are right now, and that's been my almost my entire task in the last 4 months since I've been president of the medical society is to demonstrate that despite all the things that have been said and done, there is still room for optimism. And without which I think we cannot promote rejuvenation of our profession.
Yeah, and I'm a stubborn optimist with lots of perspiration, right? I think optimism should be a verb, and making it happen is what animates many of us every day.
Yeah. Well, appreciate you coming on online today to have this conversation. And no, so thank you again, and thanks for all the work Health Rosetta is doing, and for all your advisors. We certainly will have at least one or two of your Health Rosetta advisors at our summit in June. Probably three. I'm not sure about the third one yet, but I think there's a lot of things that physicians can think about that will potentially change the trajectory of the profession.
Yeah.
So that's really awesome. And to the folks who are listening and viewing, I really thank you for joining us today. And to follow along with this conversation and learn more about my presidential initiative, please visit our website at www.pamedsoc.org/autonomy.